Sun exposure is healthy because it provides vitamin D, which keeps bones and muscles strong and healthy, but too much of it becomes a problem. Using sun protection on children does not make them to lack vitamin D. Sun protection shields the body from excessive sun heat by allowing enough heat from the sun that can provide vitamin D. The most dangerous skin cancer is melanoma because it can occur anywhere on the body. Melanoma is formed by natural pigment color cells called melanocytes, meaning a complete melanin forming cells. Melanocytes produce melanin, dark brown or black pigmentation found naturally in hair or skin, which is responsible for replacing the natural skin color and protecting the body from damage caused by ultraviolet rays. As you can see in this diagram, the left hand side are normal mode and the right hand side are cancerous mode. A, B, C, D, and E are the stages of melanoma. Causes. The risk factor of melanoma is UV light, which can occur by direct exposure to sunlight. People with red and blonde hair are more at risk of melanoma when they are exposed to ultraviolet ray in the sun. Also, people who has a melanoma background has a higher risk of developing melanoma. As you can see in this diagram, this person have added sun protection on the left hand side, and the right hand side you haven't added sun protection. So in the ultraviolet ray, the left hand side is more darker than the right hand side, and the left hand side is more protected from sunlight than the right hand side. Symptom and diagnosis. There are no signs and symptoms of melanoma, but it can be found during a routine skin test by a doctor. Melanoma is not likely to bleed, itch, or cause pain. Prevention. Developing melanoma can be avoided by reducing exposure to UV light. This can be achieved by wearing protective clothing such as hat, long sleeve, sunglasses, applying sunscreen, avoiding direct sunlight from 9 AM to 3 PM, and avoiding tanning. Sunscreen is of extreme importance when the weather is about 30 degrees or more. And when melanoma is discovered early, it can be removed by surgery. What is the goal of the project? The goal is to raise awareness of how deadly melanoma skin cancer is on adolescents and young adults. Who is the primary audience? The project is trying to reach melanoma patients, including both male and female, adolescent and young adult. Melanoma is the 10th most common cancer among adolescents and young adults from age 15 to 39 years. Knowing the causes and prevention of melanoma is important in adolescents and young adults. Who is the primary audience? Melanoma in girls were mostly seen on the lower lip and hip, while in boys it was mostly seen on faces and trunk. Melanoma in girls was nearly twice as common compared to boys, 61 to 39%. Describing the audience, people aged 15 to 19 and 20 to 24 are at risk of developing melanoma. In gender, in 41,715 invasive melanoma articles, 15,677 were diagnosed in male, 37.6%, and 26,036 was diagnosed in female, 62.4%. Female are more at risk of the incident than male. For male, melanoma was on the upper extremity of the body, while female the lower extremity of the body. For male, melanoma occur on the face, hair, and neck, while it occurs on the limb and lower legs of female. Same topic, ethnicity. The age-adjusted incidence rate was higher in female than male in every age, race, and ethnicity. Melanoma was seen on white people 5 times as many compared to other race and ethnicity. As you can see in this diagram, public awareness of skin cancer prevalent. Uncommon in female, 1.9%, common in male, 35.9%, very uncommon in female, 71.2%, and unsure in female, 1.9%. Key message of the project. The key message in this project is about warning adolescents and young adults about melanoma. The number of melanoma cases is rising more rapidly than any other solid cancer, which is caused by too much sun exposure, ultraviolet radiation. Sunshine and melanoma is not as open as it looks. Sun exposure is as important as the amount of ultraviolet radiation that reaches the skin, because melanoma is well known for its cause. What is the project trying to get the audience to do? The project is trying to warn adolescents and young adults about melanoma effect and how it can be prevented. It is by avoiding direct sunlight, wearing protective clothing, wearing a hat, and applying sunscreen. It was stated by Jency Will Delaville that intakes of dietary and vitamin can prevent cancer, especially the dietary supplement to protect skin from ultraviolet light. Same topic, melanoma risk is increasing in women who has had polyunsaturated fat and cod liver oil. Polyunsaturated fat is often found in nuts, sea krill, fish, algae, and liver grain. By decreasing the intake of this product can lessen the chance of getting melanoma skin cancer. It was stated by Jency Will Delaville that cod liver oil is a good source of omega-3 fatty acid, which is linked to reserve ultraviolet carcinogenesis, decreasing lung cancer, and protect against breast and colon cancer. Is this message applicable to the target audience? It is applicable to the target audience because it educates adolescents and young adults about melanoma. It causes symptom and diagnosis, prevention, and treatment of melanoma. It was stated by the Australian Bureau of Statistics (ABS) that using early detection methods such as screening and efficiency of treatment can increase the survival rate of the patient with the disease. Which stakeholders are involved in the project and what is their role? Stakeholders involved are friends Miriam Mom, University of New England, and the National Broadband Network. Friends volunteered in traveling with her around the country. Her mom supported her emotionally and stood by her every step on the way. UNE, the University of New England in Armada, had a project called EduU1 Helps, which helps in organizing the e-learning resource to be successful. The NBN, the EduU1 team, support with the Australian government funding NBN in making the project successful. Which community assets does the project make use of? The project makes use of schools, states, community, town, and countries. What evidence provided within the website that could be used to evaluate what would you have done differently if this were your project? Well, if this were my project, I would have used the key concept value of health promotion, which is identifying the problem that health workers face, such as communication. Health workers are not getting the message out as clearly as possible and explaining things down to the patient level. So if this were my project, I would have explained things as simple as possible. Like, for example, sitting in the sun 2 to 3 hours in a day will cause melanoma. So please avoid too much exposure to sunlight. Will this project or similar project in content or design be of benefit in your local area? Yes, this project will be of benefit to this community. Despite the fact we live in a cold climate, we have summer which goes up to 35 degrees. It was stated by Omo 2011 that Hunter, New England has the highest incident rate of melanoma in the state, which is the reason why it will be of benefit to this community to reduce the spread of melanoma. These are my references. And also this. Thank you for listening.